So I'd like to welcome you again to this month's seminar, a seminar that we decided to offer in English for our university's international community. Today we will talk about burnout syndrome, a syndrome that becomes more and more common as years go by, and we'll explain why. As I said before, there will be enough time at the end of the presentation for questions and discussion. As a disclaimer, I'd like to say that this presentation does not have a diagnostic or a therapeutic purpose. It's merely informational, and you're advised to consult your private physician or a mental health professional if you have any concerns about your physical or mental health. Before we dive into today's topic, let me inform you about the services that our counseling center offers to all of our students. First of all, students can benefit from one-to-one private sessions on the issues that worry or trouble you. Secondly, we have launched a self-improvement program that consists of 4 private sessions where we discuss certain topics such as self-awareness and boundaries. And after completion of this program, you also receive a certificate of attendance. We also offer mindfulness groups. Those are usually offered during the summer months, and you will receive a separate email when the dates are finalized. And finally, we offer seminars almost on a monthly basis on various topics regarding mental health, work-related issues, study success, and so on. If you want to make use of our services or ask questions or even make a suggestion on a topic that you'd like to hear a seminar on, you can contact me directly at my email address, the one that you can see on your screens, counseling@ouc.ac.cy. These are the topics that we're going to discuss today. We're going to see the definition of burnout, the symptoms, the relationship between burnout and depression. We're going to go through the risk factors, and we'll talk about ways that we can use to prevent burnout, of course, recognize, prevent it, and manage it. I'm going to give some practical advice on how to manage it if we're at the point where we're struggling with it. So burnout is a condition that is characterized by a state of physical and mental exhaustion. This syndrome is normally linked to work, and we will explain later how and why. Usually people experiencing burnout say that they feel worn out physically and emotionally. So it's not just about being tired after a long working day, it's about a prolonged period of time that we feel that we have no energy, no motivation, nothing to look forward to when going to work. We feel tired, irritable perhaps, useless, and even empty. We'll go through the symptoms in more detail in a bit. I'd like to point out that burnout is not an official medical diagnosis nor a mental one. It's considered a condition, a syndrome, and it should not be confused with depression. As I said before, we'll analyze the differences between the two so we can distinguish them. So burnout is not classified as a medical condition, but it is mentioned in the International Classification of Diseases, the ICD-11, so the latest version of the ICD. It's mentioned in there not as a medical condition, but as an occupational phenomenon. The ICD, for those of you who have never heard of it before, is a medical classification system edited and published by the World Health Organization, and it includes all known diseases, disorders, syndromes, and so on, medical and mental. It's used globally, and the main purpose is to guide health professionals worldwide. So burnout is included in this classification system, and according to the ICD, it is characterized by 3 dimensions: exhaustion, cynicism, and inefficacy. Exhaustion refers to energy depletion. We feel emotionally and physically drained. We don't have any more resources. Our energy levels are almost to the ground. This is the dimension of exhaustion. Cynicism, or depersonalization, as you may have heard of it, is the second dimension of burnout, and it refers to an interpersonal detachment from various components of the job. It's like we don't really care anymore. We lose cognitive and emotional involvement with our job. We feel detached. And in efficacy, the third burnout dimension refers to the feelings of incompetence when it comes to work, as well as a feeling that we're not accomplishing enough, or at least not to the extent that we would like to. The symptoms of burnout can be split in 3 different categories. We have the emotional, the physical, and the behavioral symptoms. As you can see, there are a lot of symptoms that I'm mentioning on this page. It doesn't mean that we are experiencing all of them or all at the same time or all at the same intensity. But if we're struggling with burnout, it's possible that we experience several of these symptoms. Some of the emotional symptoms, as you can see, could be stress, emotional fatigue, as I said before, emotional exhaustion. Well, what does this mean? This means that, well, when stress builds up over time to such an extent that we feel drained and depleted, we don't have any more emotional resources. We can't handle any more stress, any more sadness, any more grief, not even the slightest additional negative emotion. If you have experienced it, you would know how it feels. And this symptom, emotional exhaustion, lies at the heart of burnout. Basically, as we have tried for so long to cope with challenging situations, we have spent all of our emotional energy and there is nothing left. We're drained. Other emotional symptoms include irritability, sadness, crying spells, which could, of course, be a result of emotional exhaustion, feeling discouraged. There is a lack of motivation, lack of concentration, especially at work. There is a pressure to succeed that usually comes from within. There is a lack of interest in our jobs. Essentially, we don't feel like going to work anymore. We don't feel productive. We don't get any satisfaction from our work anymore. And therefore, we don't have interest in it, nor do we have the energy to keep working. Moving on to the physical symptoms. When struggling with burnout, we might experience fatigue physically, insomnia or other sleeping difficulties, changes in our appetite, a poorer immune system, headaches or muscle aches. In general, it's not uncommon to experience physical symptoms alongside emotional difficulties, but I need to point out that it's wrong to attribute physiological symptoms to psychological causes before ruling out any possible physical causes. So please, if you are experiencing any of these symptoms, talk to your doctor and they will determine whether they come from your psychological state or not. Burnout is also associated with behavioral symptoms such as social withdrawal and isolation, procrastination, which makes sense. If we don't like our job and we don't feel productive enough, it will take us longer to start working on new projects or finishing the existing ones. We may start using alcohol or other substances in order to cope with all these struggles. We may increase the food, comforting for some people. We may observe that we are more aggressive. For example, we may be short with our colleagues or people around us in general. We may notice that we are going to work late or that we are having long periods of absence from work. So this is how burnout affects our behavior. Let's see now. Is burnout the same as depression? Certainly, there are several symptoms that we will observe in both conditions. And if any of you is familiar with depression and the symptoms associated with it, you would have already noticed in the previous slide that some of the symptoms are the same for depression and burnout. But burnout and depression are 2 different conditions, and we must be able to distinguish between the 2 because they require a different therapeutic strategy. They can, however, coexist. It's possible that burnout is one of the factors leading to depression, and burnout actually is a risk factor for depression. Depression now is an official mental disorder. It's a diagnosis, whereas, as mentioned earlier, burnout is a syndrome, not an official psychological disorder. That doesn't mean that it's not worthy of professional attention, though. Don't get me wrong. I'm just explaining the current status of the two conditions. Anyway, how do we distinguish between the two? Let's see some basic differences. First of all, burnout is the result of long-term work-related stress. It has to do with our job, the quality of our workplace, the working environment, the conditions, and so on. Depression, on the other hand, may appear without an apparent reason or a cause. There are, of course, situations that can increase the risk of depression, such as a loss of a loved one, a divorce, but there isn't always a specific cause that led to depression. Another difference between the two is that when we're struggling with burnout, we might feel relieved from our symptoms when we're not at work and when we're not occupied with work, on weekends, for example. But when it comes to depression, there is no break from the symptoms. In fact, the symptoms are present on most days for most of the day. Also, a common symptom of depression is that the patient may not enjoy the activities they used to enjoy before the appearance of the disorder. But with burnout, it's possible that the person still finds enjoyment in different activities, especially if they are completely unrelated to work. And another difference that has to do between depression and burnout is how the person sees themselves, how we view ourselves. In depression, the patient may feel worthless and have low self-esteem, and these feelings are general to all aspects of their life. They may feel worthless as a friend, worthless as a parent, as a worker, and so on. Whereas when it comes to burnout, the negative self-image is directed to one's work. So it's not that they feel worthless as a person, but worthless as a professional. Or it's not like they have low self-esteem in general. Their low self-esteem and self-doubt is focused on their work, their profession, their career. So in burnout, they don't doubt, when we're experiencing burnout, we don't doubt our worth as a person, as in depression, but our worth as a professional. These are the main differences. Okay. Let's do an exercise. This is a self-evaluation by Mayo Clinic that could provide an indication as to whether you may be experiencing burnout or not. I will read the questions and I'd like you to write down your answer for each question. The answer can either be a yes or a no. And before I start, I want to emphasize that this is not a diagnostic tool and this exercise is not meant for diagnostic purposes, but it's just an indication that something may be going wrong and professional help may be needed. Let's take a look at the questions. Do you question the value of your work? Do you drag yourself to work and have trouble getting started? Do you feel removed from your work and the people you work with? Have you lost patience with coworkers, customers, or clients? Do you lack the energy to do your job well? Is it hard to focus on your job? Do you feel little satisfaction from what you get done? Do you feel let down by your job? Do you doubt your skills and abilities? Are you using food, drugs, or alcohol to feel better or to numb how you feel? Have your sleep habits changed? Do you have headaches, stomach or bowel problems, or other physical complaints with no known cause? If you answered yes to any or many of these questions, you might have job burnout. Think about talking to a healthcare professional or a mental health professional, or just exploring what may be going on. These symptoms could also be linked to depression, but as I've mentioned before, this is not a diagnostic tool in no way. So it's just an indication that maybe it's a difficult period at the moment, and maybe we need to explore a little bit where these symptoms and feelings may be coming from. Let's take a look at the factors that usually increase the risk for burnout. As you can imagine, when more of these are present, the risk increases. First of all, the work conditions play a huge role when it comes to burnout. When we work in a toxic or unhealthy work environment, or when we work long hours and our duties are tiring and hectic, then the risk of burnout increases. Low compensation and salary, that doesn't satisfy us. Of course, if we're not happy with our compensation, we don't feel motivated. And sooner or later, we will feel that we are offering too much compared to what we are receiving. This imbalance increases the risk for burnout. Next point, unclear working expectations. This refers to a situation where an employee does not know exactly what is expected of them, what their responsibilities are, and where their duties start and stop. This leads to stress and anxiety, which increases the risk for burnout. Next point, unreasonable workload. Let's be honest, there is a certain amount of work a person can be expected to complete during their working hours. If this load exceeds one's capacity, they will feel overwhelmed, stressed out, and even hopeless. Next point, relationships with colleagues. So frequent conflicts with colleagues and supervisors can lead to a very unpleasant work environment that may decrease our desire and motivation to work there. This unhealthy environment is certainly a factor that increases the risk for burnout. Another factor is a boring or monotonous type of work. For example, typing data on the computer could be considered monotonous, or a job that doesn't excite me. It doesn't give me any sort of joy or satisfaction. Obviously, we can't be happy at our jobs all the time. That's not a realistic expectation. But if there is nothing about our job that makes us feel good, then we may experience symptoms of burnout. Another important risk factor is the way that employees are treated. If they're not treated fairly, and I can see that others receive a more favorable treatment compared to me, then I might start developing a negative feelings towards my job. Nobody wants to be treated unfairly, and if it happens on a regular basis, it's certainly very unpleasant and frustrating. Imagine an employee who is assigned significantly more night shifts, for example, than the rest of the members of the personnel. This is an example of an unfair treatment. Next point, I am working at a place where there is no possibility for me to grow and evolve as a professional. So it's almost like there is nothing to motivate us to work harder and better. Lack of work-life balance. If we are spending too much time at work and missing out on things that are important to us, such as our family and friends, we may start developing negative feelings towards our work, which could in turn lead to burnout. And last but not least, job uncertainty could contribute to feelings of anxiety and work-related stress. It's very difficult to work productively when our job is not a secure thing. It's not a sure thing. And when there is a possibility that our contract will not be renewed, for instance, this also increases the risk of burnout. Elaborating on the topic of risk factors, there has been a recent longitudinal study that I'd like to mention that attempted to locate risk factors for burnout. They're a little different than the ones I've mentioned before. That's why I want to mention them as well. So this study followed a sample of just over 2,000 participants for 3 years in order to see how many of these individuals presented with burnout and what were their scores on different dimensions, such as insomnia, at baseline, so when the study first started. What they found is that somatic symptoms and poor self-rated health were the strongest predictors of burnout. When it comes to self-rated health, participants were basically asked to rate their general health status on a 5-point scale. Poorer self-rated health, which indicates a poorer quality of life, is associated with an increased risk of burnout. Somatic symptoms included, for example, having low energy, feeling tired, having trouble to sleep, struggling with stomach irritations, having muscle or joint pain, headaches, and chest pain. As you can see, many of these somatic symptoms are associated already with stress and anxiety, so it's not surprising that somatic symptoms were found to be a strong predictor of burnout. Other risk factors were depressive symptoms such as low mood and anxiety symptoms such as persistent worry. Stress, hopelessness, and helplessness were also assessed in this study and were found to be significant risk factors for burnout. These dimensions have to do with the way that we understand and respond to stressful situations. Higher levels of helplessness are associated with increased burnout risk, which means that people who feel that they have no control over their life and that nothing they do matters are more at risk for burnout. Hopelessness is when we believe that no matter what we try to do, there will always be a negative outcome. This mentality is obviously incredibly pessimistic and is also associated with a higher risk for burnout. We've seen the risk factors for burnout, which are the conditions that make it more likely that a person will experience burnout if they experience certain triggers. But what are those triggers? What are those environmental situations that might trigger burnout? First of all, it's work overload. When the demands of our work extend well over our capacity and energy levels, we're left feeling stressed, overworked, and exhausted. This is the most important trigger of burnout, actually. Another trigger is stress that comes as a result of my perceived lack of control. So I don't feel like I have control over the events in my life. I feel that I'm at the mercy of others. I want to emphasize the term perceived. It doesn't mean that I actually don't have control over my life, but that's what I believe the case is. Another trigger, and kind of an important one too, is that there is not sufficient reward for my work. So I put in all the work, but I don't feel like I'm getting out enough. I don't feel that the reward is appropriate for the amount of work I do. For example, my salary might be low, or I don't feel appreciated by my supervisors. Perhaps all I'm getting is criticism, so I don't feel that it's worth it. This means that I struggle to find reasons to get up and go to work in the morning. This is certainly a situation that rings a bell for burnout. And another factor is if there are unfair work conditions which make me feel that I'm being treated differently compared to other employees. For example, as I said before, I may be the only one who does so many night shifts. And quite frankly, it's difficult to accept it when we're being treated unfairly. And if many of these factors exist at the same time, there is a higher risk of triggering burnout. And finally, a trigger of burnout is conflict with colleagues and superiors. A big aspect of our work is the people that we work with. If we have frequent disagreements and conflicts, or if we work at a highly competitive rather than a collaborative environment, then this could affect our entire attitude towards our work and again make us feel like it's not worth it. Let's move on to the next section of this presentation, which is the management of burnout. First of all, we need to recognize that we are going through something that needs our attention. We have already explained the symptoms of burnout, and hopefully you have a good understanding of what you need to look out for. Then we need to try to understand the source of burnout. What brought us to this situation? And what is it in our current daily life that we cannot stand? It could be the overwhelming workload, or it could be that even though I can handle the workload, I don't feel valued enough in my company or organization. Then I need to figure out what needs to change and discuss perhaps with the HR or the management in order to find a solution. Of course, this is easier said than done, but since burnout is a work-related condition, it's important that we work out a strategy where we can achieve some practical changes in order to help ourselves deal with this condition. The first advice I'm going to give is to seek support. You must remind yourself that you're not alone and you don't have to go through this on your own. Talk to your partner or a good friend and share what's going on. More often than not, this process gives us a better understanding of our situation, and it allows us to get some clarity of what's going on, as well as what it is that we need. Also, if you feel that the situation is too much for you to handle on your own, it's advisable to seek help from a mental health professional. For instance, the students of the Open University have access to free psychological services, so you can make use of this resource to get support and guidance. Moving on to task delegation, we have already seen that one important factor that can trigger burnout is work overload. If you're at a job where you're required to work long hours without breaks and the workload keeps piling up to the point where you feel you're drowning, then you must certainly take action and try to change this situation. If, for example, you're trying to help out with the workload of a colleague who hasn't been replaced yet, you must insist with management that a solution is found and that you receive support. Or, if it's your tasks that are too much for a single person to handle, then you need to try to delegate and ask for help from colleagues, or again discuss with management and find solutions that would make the workload more manageable. The same is true for household tasks. Sometimes most of the responsibilities fall on one person in a family. Ask your spouse to help out more. Ask your kids to take more responsibilities. Remember that if you don't take care of yourself first, you won't be able to take care of anyone anyway. So changing some work conditions is definitely an important step in managing burnout. However, we all know that that's not always possible. We may not have control of what's going on at work, but we do have control of what's going on outside of our work environment. And we should take appropriate steps to help ourselves manage our stress, anxiety, depressive symptoms, and unhelpful thoughts. As I mentioned before, a good advice is to seek support from a mental health professional who is able to understand your needs and give you proper guidance, and also have a proper evaluation so that they can determine what it is that you're struggling with and offer an appropriate intervention. Another important advice is to prioritize your self-care. When everything becomes too much, it's important that you take a step back and reevaluate your priorities. You must try to take care of yourself, making sure, for example, that you have a balanced nutrition, you get good quality of sleep, you exercise, and have a more balanced life overall. Taking care of your body certainly helps. It will certainly help with your psychological state as well. So if we cannot immediately change our psychological state, we start with what we can control and change, which is the way we care for our basic needs. Another advice, which is also a form of self-care, is to add more pleasant moments in our life. Yes, we are overworked. Yes, we're stressed, but that's not what life is all about. We should make time to enjoy life and remind ourselves that life is more than just work, demands, and responsibilities. So take a break, go for a coffee, go on a date with your partner, go for a walk in the park, in the neighborhood, enjoy the sunlight, do a sport. Add these pleasant moments in your life because they can, to some extent, compensate for all the stress we are experiencing at work. One more advice is to keep a journal. Journals are a good way to stay connected with ourselves and understand our inner world, our thought processes, our emotions, our frustrations, as well as our needs. This is helpful as we're better able to recognize what needs to be changed. Another thing that we need to have in mind when experiencing burnout is that our life may be out of balance to such an extent that our personal life is completely overlooked, and therefore we miss important moments with our family and friends. moments that are important for our overall well-being. So how can we achieve a better work-life balance? Of course, we need to do the best we can to set aside time to spend with family and or friends. For example, we can say that no matter what's going on at work, Friday night will be a fun night with the kids, or that we dedicate Sunday lunchtime to family. It's extremely important that during that time that we set aside for our family, for our friends, for ourselves, we don't do anything work related. We must put off our work phone, we must turn off our computer and put it away. Do not accept any work related calls and do not read your emails. So the time that we set aside for family and friends should be dedicated to that purpose. Also, we can take on a personal hobby that we enjoy and helps us escape. This is very, very important. It could be anything, a musical instrument, dancing, a sport, reading, because we also need time for ourselves to recenter and also reward ourselves for all the hard work and recharge our batteries so we can continue working in a more productive way. And another important advice is to set clear boundaries. This is not always easy, but the more we do it, the easier it gets. We can, for example, ask our clients and colleagues not to call us outside of our office hours. As mentioned already, burnout is an occupational phenomenon according to the World Health Organization, and as such, it affects all sorts of professionals, not just medical professionals as suggested in the beginning when burnout first appeared as a condition. In order to protect ourselves and prevent burnout, we need to have some things in mind. First of all, we need to understand the importance of work-life balance, as I said before, and we need to really put in the effort to establish a good balance between our personal life, our family, friends, our hobbies, our relaxation, taking trips, and our work. So even if our work is tiring and overwhelming, this negative effect could be compensated by the positive experiences we have in our personal life. So even before we reach the point where we are experiencing symptoms of burnout, let's be proactive and take some appropriate measures to ensure that our life is at balance. Also, we need to be able to detect stress, as this could be an early indication of burnout. So pay attention to physiological symptoms of stress, such as an upset stomach, headaches, muscle tension, and please note that, as I said before, you first need to check with your doctor to make sure that these symptoms are not the result of a biological cause. Only then can we attribute them to psychological causes such as stress. Other symptoms of increased stress are nervousness, irritability, restlessness, and issues with our sleep. If any of these are present, then you need to take appropriate measures to get your stress under control. And the next point is boundaries. Again, we don't need to wait until we experience burnout to set boundaries with others. This is something we need to start working on as soon as possible. Boundaries help us have healthy relationships with people, whether that person is our partner, our colleague, our client, or our boss. And they indicate the way that others need to behave in order for us to feel respected. So go on and set some boundaries, the boundaries that you feel that are important at your workplace. It is not easy to set boundaries, but it does get easier as time goes by, and the more we practice, the easier it gets. If you're interested in finding out more about the topics of work-life balance and boundaries, I'd like to point out that we have conducted seminars, we have facilitated seminars on these topics before, and you can find full seminars on them on YouTube, and learn ways to set healthier boundaries. I'd like to finish with a quote by Arianna Huffington. This is a Greek-American author and co-founder of the Huffington Post, who went through burnout and knows how it feels to work yourself to the point of absolute exhaustion. So she says, give up the delusion that burnout is the inevitable cost of success. So we don't have to burn out in order to achieve our goals and ambitions. We can be successful without damaging our mental and physical health. It takes some work with ourselves, but we can eventually find the right balance. That's all for today. I hope you found the seminar useful. If you have any questions, you can press the button and raise your hand, and I will enable your microphone so you can talk. I'm more than happy to take your questions or hear your comments or your suggestions. Please be free. And at this point, I'd like to let you know that I will stop the recording of the seminar.